Hi and welcome to Nurse Amy channel. My name is Nurse Amy. Thank you for coming back and staying tuned and keeping a date with me. And for those of you who are coming in newly, this is Nurse Amy channel. Please press the subscribe button, like and share the video. It's quite encouraging. My students, I love you. Thank you. I'm always getting encouraged by you. I get letters from you, so I really appreciate that. And again, you can reach me directly at nurseamyacademy@gmail.com or leave your comments below. Let me know what you're thinking, what kind of videos you want more from me, and I'll be willing to do so. So this whole segment I call Nurse Amy's Lectures, and I'm going to be talking about two major insurance companies, two major insurance type of insurance that you will find is very predominant in the long-term care setting. Okay, you have Medicare and then you have Medicaid. Now, a lot of times your patients or your residents are going to have this in addition to private insurance. But for the purpose of this class, for teaching for the CNA program, we're going to be talking about Medicare and Medicaid. A lot of times people know that Medicare is for people over 65 and they stop there. Well, there's more to it. These are things you need to know about Medicare. Medicare is for people over age 65, that's true. It's also for chronically ill people with end-stage kidney disease and for people who have some kind of disabilities. So again, Medicare is for age 65 and older. It's for those people with end-stage kidney disease and also for those with some kind of disabilities. While Medicaid is for low-income people. It's medical assistance for low-income people. That's what Medicaid is. So we need to know there's two different medical assistance because you'll be asked. If not in your classroom, then in your state test. So that's the difference. So at this point, I'm going to expand on Medicare. Now, remember, Medicare is for 65 and older, for end-stage kidney disease, for some disabilities, okay? Disabilities and chronic illnesses. Another thing is Medicare is divided into 4 parts. You have Part A all the way through to D. Part A helps to pay for hospital stay, skilled nursing facilities, hospice care, and some home health care. Part B pays for doctor's visits and medical equipment and services. Part C allows private health insurance to provide some type of Medicare services. Okay, and then Part D, that helps to pay for medications that is prescribed for the patients. So you need to remember this. Medicare is divided into 4 parts, from A through to D. A pays for hospital stays, for nursing skilled nursing facilities, hospice care, and some home health. Part B pays for doctor's visits and medical services and equipment. Part C will allow some private health insurance to provide Medicare services. And Part D is for prescribed medication. Okay. Now, a lot of times you're really not asked about this, but it's good to know because your patient sometimes will ask you. However, if you do not know, you can always refer them to the social worker or refer them to your supervisor, the nurse. The nurse is the go-to person. Some things I want to add to Medicare and Medicaid. Now, the big thing about Medicaid is you have to qualify. Remember, is medical assistance for low-income people. So, for you to get Medicaid, you have to qualify. is usually provided by the federal government and the state you live in. So that's the big thing about Medicare and Medicaid. Okay, so for Medicaid, you have to qualify. And in the long-term care facility, they're usually fixed amount for services provided. And this is usually determined during admission. So those are things I thought I should mention that you should know.